Few faces look as if they've aged a bit.
Anyone else going away?
But no surprises otherwise. Where we'll get a chance to talk and get to know each other.
I have been before, but only for a day,
right
and I'd
now.
like to do more.
But I propose we make a start with this.
Gosh, been there many times when I was out in the Middle East. It's lovely.
And just to remind you, it's extraordinary because
it was one of those places I thought I want to come back here and explore more.
We felt there were some important business items we needed to transact today. So for the first half hour of this afternoon, that will be our focus. We've had a number of apologies. Simon has apologised. So Claire Skidmore is not only acting as our Chief Finance Officer, but she's also our acting CEO as well. We've had apologies from David Sidaway, Nick White, Leslie Picton, from Sean Davis, and we've recently been notified of an appointment of Pauline Gibson as the non-executive director representative from MPFT, but unfortunately she can't be here today, so she sends her apologies as well. Now, we were hoping it might be possible for all of us to be gathered together face to face, but that's not proved practical for entirely understandable reasons. So this is a hybrid meeting, and welcome to our colleagues that I can see on the screen at least. We have Trevor Macmillan, Nitty Paul, and Nicola Diamond, and also Nikki O'Connor. Good to see you all. I'm not quite sure how the Teams technology will work from my position, but I'm told, importantly, Nikki O'Connor, who's a principal presenter this afternoon, will be able to hear her loud and clear. I suggest if any of you want to make any contributions or raise any questions, you wave your hand, because that's probably the best way of capturing my attention this afternoon. So let's move on, if we may. We sent some letters out to all of you and others, formalising different appointments, different categorisations of appointments, full members, partner members, observers, and we have had some response from third sector representatives who are concerned that their observer position will not give them the opportunity to influence our discussions as they felt that they would be able to do so before. The letters are formal because we're bound by statute in terms of the membership of the committee and technically about who can contribute, particularly who can vote. I simply want to say that in the spirit of the partnership we've developed as a shadow board, my position is I will draw people into the discussion and encourage contributions wherever people feel inclined so to do. In other words, I want to try and blur the distinction between full members, partner members and observers wherever that is possible. So bear with me because it'll take a little while to get used to, and if I transgress, I dare say Alison Smith will scowl at me from across the table. She'll make sure that I keep on the straight and narrow. Now, we haven't had any questions from members of the public in advance of today's agenda, nor do we have the minutes of our special meeting on the 1st of July. They are being prepared as we speak, and they'll be available, published with the papers for the September board meeting. You might remember that was a meeting where we had to agree with Alison's consummate help to sign off various policies and constitutions, standing orders, etc. We put those on the website and said to people if there were any queries, they should contact us and we would do our best to answer them. We haven't had any queries, so just for the record, we will just make sure that is recorded. But again, if people have got queries, people who might be listening to this live stream, you know where we are, you can contact us, and we'd be very pleased to oblige wherever we possibly can. So that's all really I wanted to say by way of introduction, apologies, etc. This afternoon. The declarations of interest, I think we said at our special meeting on the 1st of July, we're no longer going to circulate the reams of paper that lists everybody's interests that never change from 1 month or one meeting to the next. We will rely upon you to notify us of any changes or updates. If you want to look at the register, it's available. for you to see and for members of the public to see. The link is shown on the agenda. I hope that's okay. At least it will reduce the level of paperwork to some extent that we have to use for this meeting. Without further ado, I want us to move into item 7.011, the NHS SCW Integrated Care Partnership arrangements, and hand over to Nikki O'Connor, who, Nikki, I hope we can hear you. You look.
I hope so too, Nick. Can you hear me okay?
We can hear you, but you look frozen. But so long as we can hear you, that's the main thing.
Oh, I can start moving. I can't see anybody else other than Trevor and me. So I'll make a brief introduction, Neil, and obviously happy to take any questions at the end.
We're getting an echo for us on the screen, sorry.
Yes, I am as well. That seems to have stopped. Okay, I'll continue. So the paper in the pack describes the importance of the integrated care partnership within the ICS. It is a key part of every ICS and is a formal partnership really between the local authorities in any ICS area and the Integrated Care Board. Its role is to bring together key stakeholders representing really the wider determinant of health. I'll pause for a second to see if I can get rid of the view figure. Okay, I'll carry on. So it is to bring together the wider partners. Sorry, Neil, I'll just pause for a second just to see if there's anything that can be done about the echo.
Can we do anything about the echo?
It's either two people have got something on close to the mic.
See if that helps.
I'll carry on. So to recap, it's to bring together partners that are concerned with the wider determinants of health to produce an integrated care strategy. It is one of the most permissive parts of the new legislation. Each ICS must have an ICP, an integrated care partnership, but the exact how the membership, apart from the founder members being members of the ICB and members of the two local authorities, and the agenda are largely left to local determination. Both local authorities, myself and other ICB staff have been working closely with the local authorities. The terms of reference are attached in the appendices, and they have been deliberately written in a way to start small, certainly in terms of membership, and to let the ICP evolve as it gets to grips with its new responsibilities. It's written into the terms of reference that reviews of progress will happen, and that the terms of reference will be adapted as necessary. Harking back to your earlier comment, Neil, however, the importance of the voluntary sector and Healthwatch are recognised within the membership. I've had a brief update just today on when some more national guidance might come out around this. It is expected that by the end of this week, we will have some further guidance on the preparation of the integrated care strategy and how that should happen. But it will recognise that this is very much a transition year, and that the integrated care strategy, which will need to be produced by December, will be interim of nature and will need to develop further. There'll also be some draft guidance for the very important role of health and wellbeing boards and how they fit together with the integrated care partnership, which should be out in the autumn. And in late September, we're expecting some guidance on the role of the Integrated Care Board and its development of the 5-year plan that will be informed by the work of the ICP. So I've probably said enough there, I think, for the minute, Neil. I'm happy to take any questions on any of that or to provide any further clarity.
Thanks, Nikki. If we could put the The mic's on again. That's very clear. You very clearly set out the 4 asks for the board under the conclusion section 3 in the report. But before we get to that, can I just ask for any comments? And Andy Begley, this is a really important piece of the legislation from a local government point of view, apart from anyone else. Anything you'd like to say about this?
I think it's just important that we recognise the couple of additional phrases within there around the developmental nature of some of the issues contained within that document. So I think it's just important that we recognise that this will be, I think with everybody's permission, an iterative process that we refine as this goes on.
Thank you. Any other comments at this stage? No? Oh, sorry. Trina.
So, in reviewing the document, I was surprised to see that the very limited provider presence at the ICB. I'm going to caveat that statement with recognising the development nature of the ICB, and as the strategy direction develops. At this point in time, it really is only the chief exec of the ICB that's present. And if that's with intent, that's fine.
Okay, it's a fair point. I suppose one could argue in the interest of symmetry that there's no one there from the independent healthcare, the social care sector provider component. And if this is really about integration, then you want to make sure that interest is taken into account as well. Is this, Nikki, something that's been discussed, and is this something, therefore, we should keep under review during the first few months of the operation of the ICP?
I'm sure the answer to that is yes, Neil. Unfortunately, I didn't manage to hear all of the comments, but heard that there was definitely a comment about the importance of provider presence. I almost feel that this is one of those, because it is so new, that it's almost try the first meeting out, see how it works, evaluate where there have been gaps in membership at that point, which the terms of reference allow, and then seek to bring further people in from the second meeting onwards. It's anticipated that the first meeting will be in the middle of September. We're just trying to organise a date at the moment. The first meeting will be hosted by TELFORD and WREKIN Council, and I think very much the first meeting will be about discussing the terms of reference, taking the most important bits of population health data that we have and looking at the 2 health and wellbeing board strategies. So I think there'll be ample time after that first meeting, Neil, to review how has that worked, should there be other members invited to the meeting.
Okay, thank you, Nikki. So if you're all broadly content, we're asked to note the role and place of an ICP within an integrated care system. We're asked to note the statutory requirements for ICBs and ICPs to produce strategies and plans for health and social care. Important to remember health and social care. You're asked to approve the appointment
transition.
Very good point. And all of your comments have a common theme about clarity, recognising that being absolutely clear at this point when, for example, NHS are trying to work out their operating arrangements just now is probably not possible, but this is a really important opportunity to try and deal with some of the confusion that exists at the moment. Tracy?
Yeah, if I could just add, I think Alison would probably agree. I think the work we've done in relation to Robert Jones and SOF 3 with the region and ICB, I think there's some good learning. I think that could apply from that. But again, avoiding the duplication, but ensuring everybody's getting what they require.
Thank you. So we'll have another opportunity to think about this in some granular detail before and at our September board meeting. Meanwhile, you're asked to note the requirements of the oversight framework, note the agreed exit criteria, and note the approach to the development of the MOU. And once it's complete, delegate sign-off to me and to Simon. Are you content with those recommendations? Everybody happy with that? Thank you. Thanks very much indeed, Nikki. So we move on to item 13, appointment of external audit service. Claire.
Thank you. By virtue of timing in terms of contract expiry for audit services for the CCG, we went out to re-procure external audit before the establishment of the ICB. That re-procurement process has happened. It was approved through the mechanisms in the CCG whilst it was still there. But actually, as part of good governance, given that this is a contract that's been let for the ICB, we felt that it was appropriate to actually bring that here to make sure that we've got a record of ICB approval of that appointment. In order for us to use proper governance to do that, we have had to establish an auditor panel for the ICB, which is a panel that reports directly to this board to make the recommendation for appointment. It's no more than the members of the audit committee, but actually as part of the governance we do need to formally recognise the terms of reference for that group who have made the recommendation also at the same time to adopt that contract. I'm happy to take questions, but the recommendations are fairly clear.
Thank you, Claire. Roger, do you have any comments you want to make?
No, it's all very straightforward, Chair.
Thank you very much indeed. Everybody happy with the recommendations as presented? If only all meetings were straightforward as this. Thank you very much indeed, Claire. So, our next meeting is the 28th of September from 2 till 5. We'll certainly aim for it to be face-to-face again at a venue to be announced. And I've only one small but important item of any of the business. This is Nikki O'Connor's last meeting. Nikki has decided to retire and to seek pastures new. And I just wanted to put on record my immense gratitude to you, Nikki, for all you've done during the last couple of years to help us navigate the sometimes very choppy waters of preparing to become an ICS. We wish you well for the future, and we will miss you sorely. And I'm sure all members of the board would agree with my sentiments. Thank you, Nikki.
Thank you very much.
So, meeting is closed. Our development session is in the next door room, and we will see you there in 2 minutes. Thank you.